So thank you everyone for joining us today. This is our fifth in our series of CEO, CFO webinars. Today, Lindsay from Stroudwater will be presenting over swing bed improvement and growth, overall development. As usual, this will be recorded, made available later on our YouTube channel, but it is a small group, so feel free if you want to unmute yourselves to ask questions, or if you want to put a question in the chat, I'll be manning the chat. And so with that said, Lindsay, I'll turn it over to you.
Great. Thanks, everyone, for allowing me to speak this afternoon. So today we are going to talk about swing beds. We're going to, really kind of hone in on the importance of swing beds and why we think that swing beds are such a vital and wonderful asset to our rural communities. Go over a few swing bed economics. I have to put a caveat. I am not a finance person. I am a clinical and quality person. So, but I know enough to be dangerous. So we'll go over a little of the swing bed economics and some of the misconceptions around, swing beds. And then some best practice growth strategies, really opportunities to kind of self-assess your swing bed program and process and understand if there's opportunities for you all for some improvements or growth. And then we'll wrap up today's presentation with some kind of best practices around marketing and promotion. So all about growth today. So why swing beds? Well, swing bed services are really this very vital and important care resources for our rural patients. And it's really an additional volume growth opportunity for the hospital. From creating various access points into our healthcare system where patients can remain local for post-acute care services or skilled care services. There is a quality component where it helps, the swing bed program can help with our readmissions and avoidable ED visits. There's a shorter length of stay. There's studies that have been published where the, compared to the quality within a skilled nursing facility, there are better patient outcomes in a swing bed hospital and program. So high quality. And of course, there's that additional, financial benefit related to the swing bed program that benefits the hospital, as well as helps with our length of stay in the 96-hour rule. What is most important is really if we have an effective swing bed strategy and process. Developing such and having that process will have a significant impact on the number of patients that we can have in our swing bed program, and really focuses on those growth opportunities. So when we look at, volume, oftentimes we look at, how many patients or how many swing bed patients should we have? Well, as a critical access hospital, you can have up to 25 patient beds. So sometimes we have folks that look at, okay, well, it's a 50-50 split mix between acute and swing beds. Or what we say is generally a best practice for a critical access hospital is based on your population of your primary service area. So for an example, if you had an estimated primary service area of about 20,000 people, we say that for every 10,000 people in that primary service area, you should be having a swing bed ADC of about 4 patients. So for that 20,000 population, expected swing bed average daily census of about 8. So then you look at your census and say, okay, well, I'm at a census of 6 in my swing bed. So there's a difference of 2, basic math here. So your improvement goal is 2. So that's what we're trying to, can we close that gap? Can we, based on your service area population and an estimated 4 patients per 10,000, depending on there, can you achieve kind of that goal? So, using that basic math, and I do apologize that this slide is probably very cluttered and small. Again, as Laura said, you'll be receiving these slides so you can kind of look to see where you are on this list. But these are the Oklahoma critical access hospitals, and pulling data from your most recent cost report and comparing it to kind of a service area calculation and population. Again, not an exact science, but a pretty good approximate. You can look to see kind of, are you meeting that for ADC per 10,000 people within your service area? So, I would have to say that I think according to this calculation here, about 50% of the critical access hospitals in Oklahoma are below kind of that target for their primary service area population. So opportunity for some volume growth within our swing bed program. And then if you expand across the nation, you can really see the yellow dots here are critical access hospitals that are, again, below that target of 4 ADC per 10,000 people. So again, very wide variation among swing bed programs across critical access hospitals across the nation. So you can see the Oklahoma ADC average is about 4.88 for the state. So just lots of variation. So with that, when we think about variation and those exceeding or not meeting or below that target, for us, it just means, there's lots of opportunity. There's opportunities that we can apply some of these best practices that we're going to talk about in just a minute, and look for opportunities for growth. So, but before we jump into some of those strategies, we want to talk a little bit about the common misconceptions around swing bed economics. Just to give you, a high level overview of, the importance of swing bed and what it does from a reimbursement perspective. There's what the swing bed program is delivering, additional inpatient rehab services to the community. It is, as we said, go back into that first slide where we talked about it's creating another access point into our healthcare system for, another inpatient hospital service. And it provides increased reimbursement while at the same time helping with our length of stay. For a patient to be accepted into the swing bed program, Medicare requires that a patient have, a 3-day acute stay. This obviously, before any COVID waivers. So in your typical Medicare patient, you had that 3-day required stay. Again, this helps with, keeping a patient as an inpatient, but, maintaining and helping with that length of stay. There was a report of Illinois critical access hospitals and understanding their revenue associated with their swing bed programs. And according to that survey, actually back in 2019, there were revenues accounted for over 20% of the total inpatient revenue. Was about 35% of CAUS reported that swing bed revenue accounted for over 20% of their total inpatient revenue. And about 9 additional hospitals, critical access hospitals, actually had swing bed revenue account for more than 30% of their total inpatient revenue. So, significant revenue generation from the swing bed program. The swing bed program, as a cost-based reimbursed Medicare program, helps to dilute any of the fixed or step costs in the nursing department. We'll go over costs in just a moment. And then really, we have the financial benefit really happens when we increase the proportion of inpatient costs that are reimbursed on a cost basis. So, and, reducing that overall unit cost by diluting those fixed costs related to inpatient services. So, that volume and cost really does impact our Medicare rate. And as you can see, we look at, when our volume decreases, our rate goes up, or volume increases, our rate goes down. Same on the cost side, our cost decreases, our rate decreases, our cost increases, our rate increases. So when we look at cost related, and we wanted to just, take a moment and look at fixed versus variable costs. So critical access hospitals have high fixed costs, about 85 to 90% versus a lower variable cost. When we talk about fixed costs, where we're talking about those costs that are not really impacted by volume. It might be your staffing of the inpatient unit, medical equipment, supplies, utilities. Those are considered our fixed costs. When we're looking at our variable costs, those are those costs that are associated that will increase or decrease based on volume, whether that's medical supplies or patient meals, pharmaceuticals will tend to be higher or lower dependent on a volume. So really the incentive around the swing bed program is really around driving that volume to dilute some of those fixed costs. So as volume grows, your fixed costs are diluted, and the faster then the variable costs will grow. So one misconception here is around non-cost-based swing bed days. So the cost-based reimbursement will only ever allow a hospital to break even. And so the opportunity is really around the non-Medicare and non-Medicare Advantage patient days. So your swing bed nursing facility days on your Medicare cost report. A lot of times we have folks saying, well, our commercial reimbursement rate is less than our cost-based rate. And so we're going to lose money no matter what. That's not necessarily true because of the Medicare nursing facility carve-out rate. So if you can look at this example here that we show on the screen, is that if your cost-based rate is about $1,000 and your commercial payer rate is $500 and your Medicaid carve-out rate is about $250. Well, that carve-out rate is carved out at the statewide Medicaid nursing facility rate. So it could be, anywhere between, $200, $350, depending on your state. And the profit that is made is the difference between that commercial payer rate and the carve-out rate. And you can see there's a $250 carve-out rate profit made based on that Medicare carve-out rate there. So really, the hospital makes a profit when the contracted reimbursement rate exceeds that statewide NF carve-out rate. And you can see that profit zone of $250. So, there's certainly opportunity. Again, we want to make sure that we highlight the different, economics related to swing bed, because those are levers. Those are, whether it's your swing bed skilled nursing, so your swing bed SNF or your swing bed nursing facility days, those can contribute revenue to your hospital. So this here is just a, contribution margin related to your swing bed. So, here's your base case, all scenario number one here at the top. And if we were to grow our swing bed SNF days by 2, what would that, difference between our net margin be in growing that ADC of 2? And you can see down here at the bottom is a $271,000 difference between the base case and the swing bed SNF increase. So again, looking at opportunities for growth and the impact to our our reimbursement and our revenue. So with that said, that's the little, teaser. But now it's okay, answering the question. Okay, great. So we get that there is a financial benefit to growing our swing bed program and the importance of kind of focusing on that those growth opportunities. So how do we get there? We already understand that we are below target. So we have this target in mind to grow our census by 2. So what is it going to take? So we've developed this process in which we think that this will help really support the growth and optimization of your swing bed program. And we break it down into different areas. One, starting with the foundation. And there really needs to be this buy-in from leadership. Leadership needs to have an understanding of the program and really be able to kind of articulate and understand what the value is, based on kind of what we just talked about. There's real economic value in the swing bed program. Some of the other kind of leadership opportunities for the swing bed program is really around kind of building relationships with our referral sources. Having those, being able to articulate the quality of your program at your hospital, the care and the competencies of your staff, the outcomes of your patient population going through your swing bed program, and be able to articulate that and tell the story to our referral sources. We also want to look at establishing a swing bed interdisciplinary team. Having key stakeholders work together really to decide on what does our swing bed program look like? What are the types of patients that we accept into our swing bed program? We're going to take a deeper dive into each one of these key stakeholders and the different roles that they play kind of in this admission process, and supporting a process in order to build and that referral volume into our swing bed program. But lots of key players in really making this robust swing bed program. So as I mentioned, kind of defining, leveraging your interdisciplinary team, the one that I just talked about. We want to start to look at developing a care spectrum. So what is it that what are the types of patients we accept into our swing bed program based on, our supplies, based on our nursing competencies? We want to make sure that we define what that looks like. And we call that, defining your patient care spectrum. We also want to make sure that we share this information with referral sources. We don't want patient or referral sources thinking that we can provide wound care when we've never provided wound care, and that's not a core competency of our staff. So we wouldn't want them to be sending, wound care patients for swing bed services. But on the inverse is, maybe wound care is a specialty of ours, and we do have, a certified wound care nurse, and we're able to take those patients. We're going to want to make sure that our referral sources know the types and breadth of care that we can provide in our swing bed programs. Many of the hospitals that you may be involved in have actually worked with Stroudwater in what we call a swing bed directory. And this was really an opportunity for the hospitals to do kind of a self-assessment, to start to develop their care spectrum and understanding, based on a online portal database where they went and entered a whole bunch of information in, the output was really, is there opportunities that we're not fully capturing from a service delivery standpoint within our swing bed program? Are we, or maybe we are doing certain things that we maybe need some additional support in, maybe we need additional training and education to be able to further offer these services, clinical resources, clinical programs, and offer those to our community and to our patients. So this is just an example of one of the outputs of that project that many of your hospitals have worked on over the last several years. In addition to building that foundation is around streamlining the admission process. So many hospitals that I've worked with don't have a very streamlined admission process. And there is bottlenecks within that process. And it isn't easy for referral hospitals to make a referral. And then, once a referring hospital, finds out that your process is broken and there's bottlenecks or there's barriers, they tend to not send referrals all that much. Their behavior starts to change if the process is not easy. So really, we want to make sure that there is a streamlined admission process. And we really need to make sure that we are leveraging that interdisciplinary team that we just mentioned. And again, we'll walk through their kind of roles and responsibilities within that admission process. And so here's what that admission process looks like. And we'll walk through each one of these processes here in the roles in which the interdisciplinary team plays a role in. Okay, so first, the pending discharge review. This is both an internal and kind of external review. And so what we want hospitals to look at is first internally, how many beds do we have available? How many, what do we have available in our hospital today in order to plan for acceptance of those admissions today or tomorrow? We also want to reach out to some of our referral sources on a pretty regular basis to really understand if they have upcoming discharges, looking for some of those post-acute care, skilled care service needs. And some hospitals are, maybe involved in a larger health system, and they may be able to do this electronically through their EHR. They may have like a read-only discharge board that they could access, and they can look at, okay, here's some upcoming discharges or pending discharges, and this patient is located in our service area. So, we can, and they need skilled care, and we can kind of proactively pursue that patient. Other times it's just, picking up the phone or doing an email to the case manager at those referral sources. Again, it's making those contacts and looking to see if there's any potentials out there. And then we're going to look at those patients needing placement and look at, based on the services that we provide and our defined care spectrum that we've worked with our interdisciplinary team to really define what that looks like, who can be cared for here at our facility, and who would be the most appropriate for swing bed services here at our facility. And then once that we go through that process, we kind of move down the line of all of these interdisciplinary team members' department reviews. And these reviews, there's lots of different kind of checks and key questions that they need to help have answered in order for that admission to be a yes or a no. And so, when pharmacy is involved, they're really looking at, do we have the necessary, medications that this patient may need, or if pharmacy has said, well, we don't have these medications available for this patient, is there a way that we can get them? Can the referring hospital send those medications? And then also looking at certainly the cost of the drug. If a patient is coming, with a high cost infusion drug, and that's something that we do not carry, that it may be a factor in determining whether or not we accept that patient into our swing bed program. The business office, the business office, there's really opportunity here is around making sure that we go through the process of insurance verification, looking at whether there's any prior authorizations needed. Or does the patient have enough Medicare days available for skilled care? And then we certainly making sure that those are checked off prior to moving through the process of acceptance here. Rehab review. Of course, with our swing bed program, oftentimes rehab is a very big, large component of the patient's experience within our swing bed program. So making sure that we have an evaluation done by rehab and what are some of the services that are being requested by the referring physician for pertaining to rehab. Whether or not the rehab service and that patient meets skilled criteria. So making sure that our rehab folks really are educated and understand kind of the specific requirements around meeting skilled care services. And then of course, making sure that we're having the skill sets and the available staff to provide those services. Central supply and DME. So this is sometimes it's an overlooked area, but this could, certainly make or break being able to accept a patient in your swing bed program. I remember working with a hospital that is in a very high rate of obesity within their community. A lot of bariatric patients actually, and they actually do not have any bariatric equipment. They don't have beds available for these patients and or special lifts, wheelchairs that are accommodating. And so whenever they have a bariatric patient or somebody that was referred to them, they would transfer them or not accept them. So again, that really can be a limiting factor in whether or not you accept patients into your swing bed program. Looking at any supplies that the patient will need. Is there, opportunity to rent something if, it's not something that we have in stock, or, or can the, referring hospital send anything that the patient may need during their stay? And then the physician review. So the physician really should be the last person that's approached. And the physician's review happens only when everything else has been checked off or passed through the prior steps. And so the physician's going to look and really, based on what has been determined through the other reviews of the interdisciplinary team, whether or not that they will accept that patient into the swing bed program. And one thing that does help often is that if we have worked together and defined what that established care spectrum is, and it makes the process a lot easier in the end if we have that established patient care spectrum for our swing bed program. Again, what does that ideal patient look like for our swing bed program? And then the physician should also, confirm medical necessity for swing bed services as well. So at the end, when the physician has reviewed, and we're ready to accept that patient, we have the patient pursuit. And so if we have determined an appropriate swing bed patient, we will, pursue that patient with that referral source and get that patient into our swing bed program. Sometimes we won't receive all the patients that we may be pursuing, maybe through our looking at our discharges back to the first step of the pending discharge review. We may be really proactive, but we may have some misses. We may have folks that decide that they're going to go to a skilled nursing facility because maybe they've been there before. But certainly we want to continue to have and build those relationships with case managers at our referring hospitals, and really establish those relationships, because that is certainly a way in which we can build our volume. The other thing is not only does this admission process help for the external referrals that we received, but it also could be applied, and hopefully a much streamlined process for our internal referrals. The patients that we've had as an acute patient within our hospital, and they are now, eligible for swing bed, they should be going through a review process as such. So again, can apply to both our internal and external referrals for our swing bed program. So what about, the marketing and promotion? How do we not only, have a really great defined admission process that's streamlined, that within that process, we've clearly defined what our swing bed program is and what types of patients we accept into it. And we have the makings of a very strong swing bed program. Well, how do we get our story out? How do we get folks aware of that we provide this service? So here I want to walk through a few key areas around marketing and promotion. And some things you may be doing, and some things maybe are new to you, or it could be something that you haven't considered before. One thing I always like to do is start with around tracking your referrals. And this is tracking your referrals for your swing bed program. And these are just any referral. These are the patients that you accept. These are the patients you don't accept. Understand where your referrals are coming from within your market. Because in tracking them and monitoring them over a timeline, because if we can say, we look on a month-to-month basis and all of a sudden there's a trend of not getting any referrals from this particular hospital. Maybe we're not getting the necessary information from them or to them, or maybe we're not timely enough for their liking, and they're skipping over us and going to the next best thing. We just want to make sure that we track our data to understand if there's any, service delivery disruptions based on some of those trends. Track all transfers from your inpatient unit and the emergency department for any potential swing bed admission. One thing we like to say is, if you have a swing bed brochure, send that with your transferred ED patient's family. Let them know, that person that went out for a hip fracture. We know that patient is going to have a surgery, and they're going to have some type of skilled rehab care after that surgery. We want to get them back home, back into their community. Let's make sure that, we communicate our program to the patient, to the family, as they're, that are being transferred out of our emergency department. Making sure that our local primary care physicians and providers, as well as our employed providers, understand and value the swing bed program. A lot of times I've gone into some markets, and the medical community doesn't understand swing bed, doesn't really understand what the big deal is. They just think they could just send their patients to, a skilled nursing facility and get the same level of care. we need to make sure that we are articulating the value of our hospital's swing bed program to the medical community. Again, we just talked about some of the relationships with the local tertiary facilities, whether that's looking at those pending discharges through the EHR. Making sure, and this last bullet here is definitely for the leaders here on the call, is to ensure that your swing bed program is on hospital's skilled care referral list. This is important because, part of the conditions of participation is to provide a, post-acute care referral list to any patient that's getting discharged with post-acute care services, whether that's home health, skilled nursing facility. And within that list, there should be, quality information that's included in there. And so we want to make sure that our swing bed program as a skilled service is included there, and making sure that we, highlight some of our clinical outcomes or our quality as it relates to the swing bed program. So when you think about, well, we don't track anything, we don't track like patient satisfaction, or we don't track clinical outcomes like we do for it, or like the home health agencies do, or the skilled nursing facilities do. This is an opportunity to start tracking, to make sure that we highlight quality indicators and metrics to be able to promote those to our referral sources. So things like the percent of patients discharged home from our swing bed program. Great quality metric. Really the overall goal of the swing bed program is to get a patient back home and into their community. So, if we have a high rate of that happening, of course, we're going to want to promote that. I did want to include this here. Again, as I mentioned, that the project that many of your hospitals are involved in is around that swing bed directory. Part of that project is inclusive of a marketing flyer. Here is just a snapshot, but it's enabled to kind of take a snapshot of your swing bed program. Has a great little spot to kind of describe your program, whether your swing bed program has a name, some basic information, contact information, your referral process. So when are your referrals accepted? Who provides the clinical oversight? What are your payers that you accept? Access to any specialist or rehab programs. Again, this is looking at what are the types of patients that we serve. And, you may be able to provide ventilator care and management for patients on vents. That's maybe not the case for all swing bed programs, but that could be something, a service that you currently offer in your swing bed program that you would want to highlight. This flyer can certainly be utilized and sent to case managers at your referring hospitals. This here is, I go back to making sure that we understand the value of the swing bed program. And some key questions really to ask is, why should any hospital refer to your swing bed program? What are some resounding kind of characteristics or key areas that you would highlight that really would hit home for your referring sources? What makes your swing bed program stand out? Whether it is, you have access to an array of rehab services. Maybe you offer speech and OT and PT. Maybe it's offered 7 days a week as opposed to many that are offered 5 days a week. What makes your program stand out? At the end of the day, your goal is really to be the provider of choice. Make it easy for hospitals to refer to your swing bed program. Obviously there are marketing materials that you could develop and, from a brochure or making sure that your website, highlights a swing bed program. A lot of times patients and families may get confused about the phrase swing bed. So we want to make it, is there something, an opportunity to kind of further describe that, whether that be on our website, on what actually a swing bed is. And then, obviously before COVID, and I don't know what your visitor policy is, but, is there an opportunity to do open houses or, tours of our unit to really, get patients and their families in to look at, what a swing bed program or swing bed unit actually entails. My key advice is always around patient testimonials. I think a patient that goes through a swing bed program often has a very great outcome and often a very great story to tell. And I think, capturing a patient testimonial makes a huge difference in terms of the promotion of your swing bed program. Was working with a hospital in Iowa, and they were caring for a lot of patients post-COVID diagnosis, coming in, off of patients coming off of ventilators and having to go through rehab to really kind of return to a new normal for them. And, this particular patient had a tremendous turnaround and rehabbed him to return back to home, return back to, biking. And so, having that story really helped that patient, that hospital kind of promote their swing bed services for that particular kind of subpopulation of patients. And then as I mentioned, the quality and outcomes information. Here are just a few examples of some quality data to be able to track and utilize that for your promotion. And then community awareness. So not only should your referral sources know about your swing bed program, your medical community, your patients, but certainly your community, because oftentimes we have family members that are making healthcare decisions for their loved ones. We want to make sure that we get the word out around our swing bed program. So whether that is where we distribute any marketing materials, provider's office, health departments, any churches or senior centers, making sure that we get that information out, not only for our swing bed program, but certainly for other healthcare services too. And then if you do have a brochure related to your swing bed program, it's a great idea to include that brochure in any discharge packet. So if you have a admission discharge folder that your acute patients receive, make sure that that's something that gets tucked in there as it relates to your swing bed program. And again, building on those testimonials, such a vital kind of, really connects to your potential patients and your community about another community's success and experience within the swing bed program. I get those, whether it's a website, a lot of folks utilize social media and Facebook to just do a capture a patient testimonial. And lastly, really around kind of marketing and promotion, here's some kind of key questions to ask. Whether or not does your community understand what a swing bed is? Again, I went back to the naming of, swing bed is a term that doesn't resonate with a lot of people, but maybe transitional care or Maybe it's naming your program, steps to home. I've heard lots of different swing bed programs have some creative names that really describe the program a little bit clearer than a swing bed. You can imagine what people think when they hear of swing bed. And then, are there any opportunities to expand swing bed capabilities or services? So again, it's going back to the defining your patient population, you're defining what your care spectrum is related to your swing bed program based on, our competencies, our access to various equipment or specialists. What is that ideal patient look like for our swing bed program? When we look at our admission process, are there any gaps or barriers in obtaining those referrals, whether that be internal or external? A lot of time there are internal barriers that really prevent that admission process or even that referral process to run smoothly. Um, you know, I've heard multiple times that, rehab tends to be the barrier. That maybe you have, your rehab, maybe physical therapy is just an outpatient service at your hospital, and they may come over to the hospital just to see inpatients, once a day to do evals and kind of set up the plan of care. But they really are truly kind of an outpatient rehab group that doesn't necessarily have a desire for inpatients. Believe me, I've heard that story multiple times. So it's nothing new to me, but it really creates a barrier because they may be a limiting factor in your referrals, in accepting of referrals. So you just want to kind of hone in to see if, maybe this is happening at our hospital. And is there a way that we can work through that or figure a better process out? And then lastly, how will we measure success? If we've done all these things, and we've streamlined our admission process, we've defined who our ideal patient is, we've maximized our marketing and promotion, how do we measure success? Is it that increase in that closing the gap with our target ADC? Is it around some of the quality and clinical outcomes that we're going to measure and monitor? So you really decide on, based on all of these components, what are some key measures to success, and how do we want to measure the growth and optimization of our swing bed program? And that's it. So I do have some time. Looks like we're about 10 minutes left for some questions. If anyone has any questions, be happy to chat.
All right. Well, thank you, Lindsay. I've been watching the chat. I don't see anything come up just yet. Oh, where can I find your YouTube channel? Let me put it in the chat, but I will also send, once this is posted, the link to it as well. There you go. But yes, once we post all of our webinars, we put them on that YouTube channel and I send out the link, and you'll have access to this one, plus many others. We have an entire swing bed series. We have all of the webinars from this series. We have several MBQuip quality webinars, as well as Rural Health Clinic webinars on that YouTube channel. And Lindsay, thank you again for presenting to us. I really enjoyed the promotion portion, and really a question we get from folks outside of critical access hospitals is just, what is a swing bed? So thank you for all of the good ideas.
Yeah, absolutely. And happy to, I do at the end of my slide deck should be my contact information. Happy to answer any questions offline via email, or you can just touch base with Laura. She's always good about getting in touch with me. Thanks all, and have a great afternoon.
Yes, thank you all. Yes, it's July 14th. I apologize. I had to look it up on my calendar. But yes, on July 14th. We recorded the webinar today, and as soon as we get it posted on YouTube, I'll send it out, and I'll also send out a reminder with the link to register for the July 14th webinar. So thank you, Lindsay.
And they'll send the slides too.
Perfect. And everyone have a great day. If you run into any questions or anything, please let me know. Thank you.
Thanks all.